Good evening, everyone. We're going to get off to a slow start. We don't have our full panel of candidates with us yet, but I will talk slowly, and maybe by the time we get through the introductory section, we'll have everybody with us. And out of great respect for those of you who are here, we're going to get going. And thank you so much for joining us for Mental Health Colorado's candidate forum for Boulder, Weld, and Larimer. We do not endorse specific candidates, but we really believe that it's important for elected officials and voters to be thinking about mental health as part of the work that we're doing together as a community. And that's why we like to host these candidate forums and give everybody a chance to say a little something about where they are on mental health. And, I want to apologize in advance that we've got a compact period of time and a bunch of people with us and a bunch of different questions we're going to get through. I know that we could talk at much greater length about mental health in our communities than we're going to be able to today. So apologies for that compact nature of tonight's event. We are not pitting anybody against each other. This is not about debate or competition. We're really just wanting to share thoughts and ideas as we, as an advocacy group, develop continued bipartisan and nonpartisan support for greater mental health outcomes in our communities. So thank you again. And rather than having everyone introduce themselves, I'm going to share your names. And then what we're going to do is I've got a set of questions, and I'll direct each question to a specific set of you, and which we've chosen randomly. And then we'll have about 2 minutes for you to respond to the question, and we have to stay pretty close to that timeline so that everybody has a chance to speak. We're again just want to thank you all for being here and for your commitment to supporting the mental health of your communities. Excited to have you with us. So we are pleased this evening to have with us Ryan Armagost, candidate for House District 64, a Republican. And if you could just wave. Lisa Chalet, candidate for House District 65, a Democrat. Representative Judy Amable is not with us just yet, but may join us. We have Spring Erickson, candidate for House District 48, a Democrat. We have Representative Mary Young, candidate for House District 50, a Democrat. We have Gabe Evans, candidate for House District 48, Republican. We have Representative Kathy Kipp, candidate for House District 52, a Democrat. We have Representative Andrew Bazenecker, candidate for House District 53, a Democrat. And we have Commissioner Byron Pelton, candidate for Senate District 1. And I'm not sure, honestly, if commissioners identify with their parties as part of their platform. So we do. Very good. Thank you, Commissioner Pelton. All right, now I need to keep track of where my screen is. So we're going to get started. And just looking back to see if Representative Amable has joined us yet, and I don't see her. So I'm going to try and keep track of that because she was in the first group for our first question. But we'll go ahead with that as we are. So our first question, we're directing to candidates Ryan Armagost and Lisa Chalet. And each of you will have 2 minutes to respond. So as I'm sure you've heard or Colorado has been ranked as 51st in the nation, including DC, by Mental Health America for adult access to mental health care. Our state also has one of the highest rates of death by suicide, has rising rates of homelessness and addiction, and is facing a serious youth mental health crisis. We often hear politicians listing the need to improve mental health while campaigning, but don't as often hear about a real plan. If elected, what are some of the steps or policies you would pursue to fight for real change in our mental health system? So let's begin with Ryan Armagost, if you would.
Thank you, sir. Yes, it is pretty alarming that we are second from the worst there. We're one of the worst states in the United States for mental health. I think the biggest thing that comes from that is the fact that we have one long-term treatment facility being in Pueblo, Colorado. And as a former law enforcement officer, we would have people sometimes where we would have them detained for a crime that they committed while they were on a mental health crisis. They were in a mental health crisis or addiction crisis, and they would be diagnosed and have to wait for a bed, sometimes up to 6 months. And constitutionally, a lot of times they couldn't be held that long and detained that long. They'd be released back to society and be kind of in a vicious circle of being incarcerated and reincarcerated, reoffending upon release every time. I think there's a broken system between our law enforcement, our criminal justice system, and the state as far as providing a pronounced healthcare and treatment plan for them for their mental health, and fixing that, binding that, making that something that's more concrete and more well-defined is going to be something that we can definitely work on as a state, in our legislature, to make sure that we have a well-defined system, not only to provide that for people that are in the system or otherwise in mental health crisis, self-medicating or whatever, but also providing more facilities so that we're not just relying on one overwhelmed facility being in Pueblo, more facilities throughout the state, even if there's secure facilities or otherwise less secure facilities that we need for incarcerated individuals, high-risk individuals, and just individuals that need a very intensive treatment plan.
Great, thank you so much. And thank you for staying within your 2-minute frame. This is a big question, and would love to engage all of you at greater length and hope to get a chance to do that in time to come. But tonight, again, appreciation for your respect for that limitation. So we'll move on with the same question for Lisa Cholet, and just let me know, raise your hand or something if you need me to repeat the question.
I think I understand the question. Mental health is something that I care a lot about. It is something that I'm actually running to help improve and change. Part of that is on the criminal justice side, as Mr. Armagost was talking about. And one of the alarming things that I find is that within the criminal justice system, specifically to people who are sentenced to the Department of Corrections, is that they pretty much apply a one-size-fits-all method of medicating without therapies, just kind of trying to put a Band-Aid on the problem. In addition, just the entire way that the criminal justice system is run does not provide an avenue for offenders to feel a sense of control in their own lives, which directly affects mental health as well. So one of my big platform things is to kind of revamp how criminal justice works in our state and set up the Department of Corrections in a way that puts offenders' mental health as a priority, but in addition, when they leave prison, they have a sense of opportunity for a new path with tools to go with that, both on the mental health side and on the job skills side. In addition, I want to see a policy that makes mental health treated the same way the rest of our healthcare is, and that mental health is insured, funded, paid for in the same manner that we do for going to the doctor for a well-child checkup. If we start taking mental health seriously and put forth policies and changes that require insurance companies to treat it that way, then we can actually start solving those issues. And until then, we're going to continue to struggle and fight. I would like to see mental health for our youth. They've gone through so much with COVID and being trapped at home. I mean, trapped is not the right word. They were being kept safe, but that social emotional growth that happens, especially in middle school, having a middle schooler, they're really suffering. And so I would like to see policies that make that a more robust opportunity for our youth.
Great, thank you so much. And now, so I see that Representative Amabile, you've joined us. Thank you so much for being with us this evening. We had you in the group to answer this first question, so I'll just repeat it in case you missed that when you came on, I didn't see. So we've just been talking about, given all that we know about Colorado's ranking regarding adult access to mental health and high rates of death by suicide and rising homelessness and addiction. We often hear from politicians about the need to improve mental health, but less often hear about planning for that. And the question is, if elected, what are some of the steps or policies you'd pursue to fight for real change in our mental health system?
Okay, thank you. And sorry for being late. I, for some reason, thought it was at 6. And thank you to Kathy Kipp for alerting me that you all had started. So I think we could do anything. We have to do anything. We have to do everything. We're last in the nation. We could look at any state. We could look at Alabama, Kentucky, Missouri, Mississippi. They're all doing a better job than we are. But I think one of the big keys is setting up a continuum of care for our civil system. So right now, you have a mental health crisis, you get sent to a hospital, you stay for 3 days, and then you're released. And you're oftentimes released back to homelessness if that's where you were when you started. And nothing has really changed for you, except for that you got stabilized for a minute. And we see people are cycling in and out of these short-term hospital stays. And that costs a lot of money. It's about $1,500 a day to go to one of these short-term hospital stays. It's ineffective and it isn't working. And so when we see somebody cycling that way, we should immediately say, okay, this person needs a higher level of care. Or if somebody, they do get stabilized, maybe they need a lower level of care, but they certainly don't need to be sent back out into homelessness. So we have to create this continuum of care. And my mantra has been beds, beds, beds. And last session, we did manage to get 125 beds through the Behavioral Health Transformational Task Force that will be both step up and step down beds for people who need that level of care, which isn't hospitalization, but it is residential treatment. So that's a start, but it isn't the whole thing. And then we continue to treat them throughout their life. Just like if we identify you have diabetes when you're a kid, we don't just give you some insulin once and then say, okay, well, good luck. We actually now know that you're a person who is going to need a lifetime of care. So we have to do that with mental illness as well and follow people throughout their lifetime and make sure that they are getting the care that they need. And then with regard to the intersection of the criminal justice system and mental health, I think that oftentimes is the result of a failure of our civil system. So we're not getting people into treatment, and then we're letting that situation deteriorate to the place where they end up committing a crime, and then they're in our criminal justice system. And the only way we can solve the criminal justice problem is by addressing the civil system. And that is not just beds, but I do think beds is a big part of it. It's also making sure they have outpatient treatment and ongoing treatment. Thanks.
Great. Thank you. Thank you, Representative Amabile. All right, we're going to move on to our second question. And again, apologies for our shortness of time and the material we want to hear from everybody. So our next question we're directing to Spring Erickson, Representative Andrew Basenecker, and Representative Mary Young. And as a reminder, we've got 2 minutes for each response. So youth mental health is obviously a serious issue that has received constant media attention, especially over the last couple of years. And there are many ideas about how to help young people most effectively. Do you think we're facing a youth mental health crisis, or what are the indicators you're seeing of that? And what are some initial policies or initiatives you would support to start tackling this issue? So we'll begin with Spring Erickson, please.
Thank you. The biggest thing, especially that we see with children and young adults with mental health, is that they're not being checked for the signs, and that was something that was brought up today on CNN. The American Medical Association has actually said that we need to start screening children as young as 8 for depression because of what has happened with the pandemic. And I'm like, screening's great, but if you find it, how do we address that? And one of those things I think is through therapy, and letting the parents know that therapy is available and it should be part of our healthcare system in that terms. I also think that schools need funding for therapy in the school districts. We here in all 5 of the school districts in our district here in 48 have a limited amount of therapists who actually work in each school district. Most of the school districts have 3 for the entire district. And that is just not enough to help address screening and helping getting those kids into therapy, either inside the school district if a family can't afford it, or getting them outside care through like North Range Behavioral Health here in Weld County. It's just, that's what we need to look at, and how we can do that is funding. Unfortunately, we have a very limited budget in terms of what we can do under the cap with Tabor. And we need to continue to find ways and resources to make it that funding is available. And if that is through private partnerships, then that's what the state needs to work through. Thank you.
Great, thank you so much. And thank you for mentioning funding. That's sort of a separate part of this question, which I should have just go ahead and included up front, since we don't really have time to circle around for a second answer. And along with that question about initial policies or initiatives you would support to address young people's mental health, what do you support in terms of school policies and funding that is increase availability of mental health services and supports in schools and early childhood settings? So the next respondent for that question is Representative Andrew Basenecker.
Thanks, Vincent, and thanks for the great question. So I have a couple thoughts here. The first is that I think, across age groups and demographics, there continues to be widespread stigma around accessing mental health services and being honest about when you need supports and for mental or behavioral health. And I think, that's not only true for children, for youth, but also for caregivers, guardians, and parents as well. We've really seen, I think, the impacts of the pandemic come to a head this school year as more and more young learners and children have really struggled with some perhaps previous mental and behavioral health issues that have become more acute and pronounced in terms of what the pandemic has done to folks in our communities. So I think it's more important ever than before. I think we continue to see this through reports from school psychologists, school counselors, and folks who are really on the front line of helping young adults and young learners and young folks in our communities struggle with some of these issues. I think one of the positive things we've done as a state is to continue to support and increase funding for the iMatter program and any pathways we can give for a child to be able to access mental or behavioral health services and have those supports early in the process is super important, right? And it's one of the ways that we can empower folks really to take ownership of their own mental and behavioral health. I think school health, mental health professionals also remain an area of need. And of course, that comes with challenges in terms of funding, but it's an important part of the process as well. And then I would just say equity in care is also a critical piece of the puzzle here, right? Because we know that the pandemic has disproportionately impacted certain populations. And we know that certain populations will always have a harder time gaining access to services or even affording them in the first place if that's the barrier. So I think we really need to keep that equity lens in terms of how we're able to provide it, as Representative Amabile said, a continuum of care for folks who struggle with mental and behavioral health. And then also working to ensure that we have adequate services both in the metro parts of our state, suburban, and also rural parts of our state as well. So it's a pronounced need, and I think one that we're going to continue to have to come up with some very creative solutions to meet the need across the state.
Great, thank you so much. Now, Representative Mary Young, would you please respond to that same question and let me know if you need to repeat it?
Thank you very much for the question. This issue was the primary reason I came to the legislature as a school psychologist. Prior to the pandemic, I saw that we were not adequately providing for the needs of our youth as far as mental health is concerned. So I immediately became part of the behavioral health task force that the governor had started in 2019. And one of the committees was the youth subcommittee. I was on a variety of committees, but I really focused on that. And as a result, that task force had a wide variety of issues that we're tackling, but the primary one was the establishment of the Behavioral Health Administration. And of course, I made sure that as the co-prime sponsor and active in the development, I made sure that youth services were critical to that. That was also followed up with the ARPA funding, the task force that was developed to decide how to spend behavioral health money. And I think I'm going to start with the whole issue of continuum of care also for youth. And some of the signs for me that this is ongoing is the number of students who have not returned to schools, my conversations with school personnel, and I knock on a lot of doors and I hear from a lot of families when I talk about this issue that their families are impacted by this need. So we did have the ARPA money that did give crisis money, but I see my time's just about up. But I think we need to make sure that we fund the Behavioral Health Administration and to provide that continuum care for students, and after the ARPA money is done. Hard for me to cut to 2 minutes on this.
I know. It's impossible on all of these, and I'm so sorry again for that, and really grateful for the richness of thought and conversation, and to all be speaking the same language with different ideas and angles on this. So our third question will be directed to candidates Gabe Evans and Commissioner Pelton and Representative Kathy Kipp, and again, each with 2 minutes to respond. So unfortunately, in Colorado, as in states across the country, the criminal justice system has become a stand-in for an accessible, affordable, quality healthcare system. And some of you have spoken to this. How do you see the intersection of the mental health system and the criminal justice system? And what changes or policies would you support to make both operate more equitably and effectively to promote our health and safety? So let's begin with Gabe Evans.
Well, good evening, and thank you so much for having me here tonight. So again, Gabe Evans, running for House District 48. Like Ryan Armagast, I spent over a decade in law enforcement, so I really do appreciate that question. And going back to an earlier comment, I think that, a lot of times law enforcement becomes involved in the mental health care system because there are no other options, starting with pretty much trying to end the discrimination and the stigmatization of mental health care in the 70s. We removed a lot of those institutional, which, legitimately were kind of causing a lot of problems and stigmatizing mental health care. We removed all of those systems, but we didn't replace it with anything. And so now a lot of times, because there is no one else who can come out and respond to these things, when folks have nowhere else to turn, they turn toward, first responders, which does involve the criminal justice system. So going back to that topic that a lot of folks have spoken about already, having more resources, that continuum of care, short-term, long-term resources, that's critical, because as a cop, when I got called to stuff, didn't want to be a mental health care provider, but there was really no one else. And it was frustrating for me that I couldn't give anybody short-term or long-term resources to actually address those problems. So I think that's one of the first issues, is actually making sure that we can get folks into some sort of stable care so that law enforcement doesn't have to be involved for things that should just be a mental health issue. For that intersection where you do have, crimes that may have occurred, and we also have to remember the victims in these situations too. And you have to have that balance between how do we have some sort of restorative justice for whoever is in the mental health crisis, but also not forgetting our victims of crimes as well. One program that we have that I've seen work very well is mental health courts, which is basically a form of deferred prosecution. So what that means is, hey, you did something in the crisis, in a moment of crisis. We're going to write it all up and document it, but we're going to defer the prosecution pending some sort of treatment for you.
Great. Thank you so much. Commissioner Pelton, would you please answer the same question?
Yeah, I totally agree with everything that Gabe just said. And I also, especially out here in rural Colorado, we deal with a lot of issues where we don't have enough resources or services, and that we have to rely on law enforcement or our jails, or like Advantage Treatment Center, which is a halfway house that also provides a lot of treatment. And it's not, trying to get the stigma away from that would be a really good idea. But I think the most important thing that we need to focus on is resources. The behavioral health system, and I cannot remember the number. I think I remember saying it last year, was $1.3 billion is spent in the behavioral health system. And with the introduction of the BHA, making sure that we have transparency, accountability, and accessibility with the BHA is going to be huge. And I think that working with those, with the BHA, and making sure that we have the resources to come out to rural Colorado, where our mental health centers can be strengthened with that, and not be able to be losing the funds that we so richly need out here. We so desperately need out here, because like I said, we don't have a lot of options. The only options that we have out here in northeastern Colorado is putting a young person, or a person that has mental health or even substance abuse issues, and sending them to Island Grove and Weld County, which, that's pretty much our only option especially when it comes to substance abuse. And a lot of times they get sent back because there's issues with paperwork or some other bureaucracy that happens. So the biggest thing is that we need to really focus on the resources and that are already being spent, and make sure there's transparency to them, so we can be able to use that out here.
Great. Thank you so much, Commissioner. Representative Kathy Kipp, please let me know if you'd like me to repeat the question.
I'm good, thank you. Hey, thank you for having us here tonight, and I'm really glad to see that we all have a common thread, and that we agree that we need to spend more resources on mental health and behavioral health within the state of Colorado. I will say that, during the pandemic, we took a lot of the federal money that came into the state and put a significant chunk of that into behavioral health. And so I have to say, Representative Amabile and Representative Young, who are here tonight, are two of our biggest champions in the State House when it comes to mental health and behavioral health. And we all have our areas of expertise. I tend to follow people who have a lot of experience in these areas like them. I do know that our prisons should not be warehouses for people who are suffering from behavioral health issues. in Fort Collins, where I live, and I know they have a similar program in Denver, and I believe maybe there's programs elsewhere in the state. We have co-responder programs, so that when somebody has a mental health crisis, you just aren't responding solely with a police officer, but you're responding with somebody with some mental health expertise. So I think being able to get in there and properly identify a situation without escalating it is important. The housing is another area where we intersect, right? If you've heard of the Housing First initiative, and that was another significant area where our legislature has put a significant amount of funding is into homelessness and affordable housing. And the reason for that is until you have somebody's basic physical needs taken care of, that they can get addressed in their housing, you can't really address the other needs in their life. And I think my time just ran out, but there's just so much. And yeah, thanks for asking the question. Sorry, I set my timer and it went off.
Oh, no, thank you so much. Right on time. So our next question is for candidates Lisa Cholet, Representative Mary Young, and Representative Basenecker. And again, 2 minutes each. The death toll from fentanyl continues to rise, and many believe increasing criminal penalties for people who use drugs is the answer. We know there are wait lists across the state for access to substance use treatment. People want care but are unable to access it or afford it. Do you support increased criminal penalties for people living with substance addiction, as similar to the way House Bill 1326 increased those criminal penalties in the 2022 session? And part of the question is, and do you, what is your state of belief with regard to state investment in more funding for harm reduction and treatment? So again, beginning with Lisa Cholet.
Okay, thank you for the question. We had a similar question at the League of Women Voters. And so I'll share with you that my best friend's niece just passed away a few weeks ago from fentanyl poisoning, is what I would refer to it. She unknowingly used an illicit drug that was laced with fentanyl. And I think that the bill that you were referring to from the last legislative session, one of the key components in that is the word knowingly. And in the criminal justice system, that knowingly part really starts to separate those with substance abuse problems with those who would wish to make money off of the addiction of others, right? And so I don't support per se criminalizing and punishing people for their addiction. However, I have seen firsthand often that removing them from, I don't want to say their community, but temporarily putting them somewhere where they can get it out of their system and have an opportunity for rehabilitation, it would be something I would like to see. Maybe it's not punitive necessarily, but like you said, there are people that really want help, and those resources aren't available to them unless they go out and commit a crime, and that's unfortunate. I happen to know a lot of opioid former and current addicts. I mean, no is probably not the right word, but it's something that I'm very passionate about. And so with the fentanyl, I would support anything that allows people to test the test strips part of that bill, so that if they are choosing to engage in the use of illicit drugs, they have the ability to at least keep themselves safe from a fentanyl poisoning. I do believe that we need to have stiff penalties for those who are lacing drugs with fentanyl, selling fentanyl itself, bringing in the ingredients to manufacture synthetic fentanyl. Any of those things I have a zero tolerance for, because this is not what it was like when I was in the 80s and some of my friends might have messed around with cocaine. I was never that brave, but you don't think that you're gonna die. Am I over my time? I usually have my timer on. But anyway, so I just think we need to get creative and think outside the box to keep people safe and get the drugs, the people that are putting those drugs into our society, away from our society.
Thank you. No, and good timing. So next, same question, we'd like to hear from Representative Mary Young.
This is really an earth-shattering problem, the problem of fentanyl. I have a long lived experience, and I've never seen a drug that has this level of lethality. I did vote for the bill last session. I primarily voted for it because of the great amount of harm reduction that was built into the bill, because I really do think that is what we need to provide more for. And I was happy that we were providing funding for in the judicial system for harm reduction. At times, not all jail systems have been happy about working on MAT and other methods. I really don't think increasing penalties for individual use is effective, but I do think increasing penalties for distribution is very important. And in talking to law enforcement, that is a challenge for them. And I think we need to continue to look at this issue. But really, as far as individual users, I think the more we can input with accessing behavioral health substance use supports, the better outcomes we'll have.
Great, thank you so much. So next on the same question, we'd like to hear from Representative Basenecker.
Thanks, Vincent. And I think it's a great question to ask. And I'll be honest, I struggled with some of the debate around the bill, in as much as camps were clearly divided into one train of thought that very much categorized as debate around the bill or any passage of the bill, including stiffer criminal penalties, as being a return on the war on drugs. And on the other side of the camp, you had folks who I think very much opposed any sort of treatment options for folks, in as much as they viewed a very hardline approach as the only way forward. I think this policy, quite frankly, and this fentanyl epidemic deserves much more nuance. And so I voted for the bill, and I can tell you why I did it. I do not view it as a return to the war on drugs. I think that is a very different time in our history and a very different set of policies which informed how we treat and deal with folks who are struggling with addiction in our communities. And at the same time, I think there remained a significant gap in our ability to disrupt fentanyl trafficking rings here in the state of Colorado. And that is a tool that I believe we needed to give our law enforcement officers the ability to interject themselves into and really keep the public safe. Some folks wanted a zero tolerance policy in terms of possession. That is not something that I viewed as helpful or that I was willing to go down the road. The felony possession charges included in the bill can only lead to jail and not prison. And the new felonies can be downgraded to misdemeanors if folks complete treatment programs. And so there's multiple off-roads to that felony piece that I think are important to note. I also supported the bill because it included $20 million for the purchase of naloxone, $6 million for harm reduction programs, and $3 million for MAT treatment as well. I think those are significant investments. Testing your drugs isn't enough. If you think about the chocolate chip cookie approach, I mean, one portion of your drugs might have fentanyl in it, another portion might not. And as well, I think what we want to make sure is, in terms of the thresholds, is that we're not disincentivizing the need for folks to test their drugs simply because now if they know, that's a problem. So those thresholds were important. Was the bill perfect and everything I wanted? Of course not. I don't think anybody got everything they wanted on that bill, but I do think it's an important step forward in order to keep our communities safe and to disrupt the trafficking rings, which I think we are continuing to see that impact on our communities.
Thank you so much. All right, moving right along from one hard topic to another. The next question I'll direct to candidates Ryan Armagost, Commissioner Pelton, and Representative Kathy Kipp. And again, 2 minutes to respond. So we've seen a string of, a long string in Colorado and nationally of what, as we examine them, look very plainly to be avoidable tragedies and fatalities involving police and crisis response. Here in Colorado and everywhere. It's painful for us to look at. So tell us, do you support policies that will expand programs that reduce harm provide police with de-escalation training, and standardize crisis response by crisis respondents trained in mental health. And we'll begin with Ryan Armagost.
Thank you for the question. As I spent 10 years in law enforcement, and as a crisis intervention coach, I trained people in crisis intervention. And not only that, I'd say very experienced in tactics as a tactics instructor. So in responding to people in crisis, I think that dynamic has changed significantly, especially over the last decade and even the last few years, where people that you're responding to, when confronted with law enforcement, immediately go into crisis and even a homicidal or suicidal state. There's nothing that de-escalation or tactics can do as far as training goes to further de-escalate somebody that simply has homicide or suicide as their end goal in those moments of crisis. The only thing that we can do is find a way to have intervention for those people before they get to that point in crisis, because law enforcement response is to protect the public, number one, protect themselves and fellow officers, and number two. So if somebody is a threat to the public or the officers responding to that scene, there's very minimal options that you can do to de-escalate those situations, or otherwise crisis intervention, even with a co-responder, that is a deadly force situation. So unfortunately, that's kind of the point of no return. It's prior to that point that we need to address is the biggest issue, because that's the only point we can intervene is before those people get to that moment of crisis.
Thank you. Commissioner Pelton, please respond to the same question, if you would.
Yes, thank you, Vincent. I like the question, and I would support a lot of those policies. I like them. I also like the co-responder programs. I know commissioners across the state, Summit County being one of them, who has been very successful with the co-responder programs. I'm trying to get one started here in Logan County as a commissioner. But I think that we really need to be careful about some of the ways that this is done. I think that the biggest thing is that we need to be very sensitive to the fact that we need to be, like Ryan said, that we need to get in front of these people before the crisis hits. And I think that that's the biggest important part of that. And I think the training our officers and training because I don't ever want my sheriff's deputies to be mental health specialists or substance abuse specialists. You know, they're there to do a job to enforce the law. I get that, but we need to be very sensitive on how we also have crisis intervention. And you know, I know our sheriff's deputies and our police force here in Logan County has been very open to having those trainings. Trying to do some of the stuff like a co-responder program has been very difficult to try to get started here because of our workforce shortage. But I know that is very important, and I think that it's and we need to keep working towards some sort of solution. So thank you.
Thank you. All right, and now we'd like to hear from Representative Kathy Kipp on the same question.
Thank you. Yeah, I think those are obviously all good programs. I mentioned, you know, Fort Collins already has a co-responder program in my last answer, and de-escalation I think is really important. And you know, we face a number of issues that sometimes make the situation worse. Our police officers, we did pass 217, which was our police reform bill back in the summer of 2020 after the murder of George Floyd. And I think because of the place that we are in, we need to recognize, you know, we're not trying to vilify police, we're not trying to vilify anybody, but we do need to make sure that when people do call the police, that people are treated with respect and dignity, and that the fear goes away. I have a particular situation where I called the police in our co-responder program to respond to a constituent who's clearly having a mental break, and a person I know said, well, are you sure you should have called the police? Well, is that really where we want to be? No. So I think that the increased training is critical and vital. And I also think, we do have a shortage because of what's happened in the last few years of people who want to become police officers. So I really think that we need to make sure that as we're building back our police force, we do it in a smart way with good training, but also increase the diversity of our police force. I have a bill that I'm looking at for next year that I believe will help us accomplish some of that diversity of our police force. But we just need to make sure that we're treating everybody respectfully and giving everybody the resources they need.
Great, thank you so much. All right, well, the final question of the evening I'll direct to Representative Judy Amabile and Gabe Evans and Spring Erickson. Each candidate will have 2 minutes to respond. So extreme risk protection orders, also known as red flag laws or ERPO here in Colorado, allow law enforcement to temporarily remove weapons from individuals who are deemed by a judge to be a significant risk to themselves or others. Do you support extreme risk protection orders to prevent gun violence towards self and others? And again, we'll begin with Representative Amabile.
Oh, thank you. So yes, that's my answer. Emphatically, yes. I testified in support of that bill. And I'll just tell the story that I told to the committee. I have a son who has schizoaffective disorder with co-occurring substance misuse disorder. And he told me one day, I'm going to get a gun and kill myself. And I called up the Colorado Bureau of Investigations and said, can you please put him on the list of people who can't buy a gun? And the guy chuckled on the phone and said, yeah, there's no such list. And then I saw on his debit card, which at the time I had access to his bank account online, that he had charged about $10 to the gun shop across from Boulder High School. And I called them up and said, what can you buy at your shop for $10? And the guy said, well, that's a background check. So my husband and I went running down to the gun shop and we said, what's going on? And they said, well, this is the weapon that your son is buying. And here's the background check, but it didn't come back instantly. We don't know why, but when it does come back, then we will have no reason not to sell him this gun. And we cried and we, begged, and they said, okay, that's fine. They were super nice. And they wrote on the background check, don't sell the gun. So when I went to go testify, I talked to somebody from the Colorado Bureau of Investigations who told me that my call to them may have delayed the background check. And if they didn't know, that person didn't know, but he said, just my calling, they did take down his name and number, and that may have delayed the instant approval. And that saved his life, because if he had been able to buy a gun that day, he would be dead now. And it shouldn't be that way. Somebody like me who has a kid like that, who knows that he's in trouble, should have the ability to go to the court and say, please don't allow my kid to buy a gun. So I think it's a good bill, and I think it's done a lot of good. And I think the data is coming in that shows it hasn't been misused. And I'm fully supportive of it. Thanks.
Thank you. Gabe Evans, if you would.
Yeah, so, the first off, I think that using the term gun violence is a little bit of a misnomer because, during my law enforcement career, I just saw violence. Whether or not people could get their hands on a gun or a car, we just saw this down in Golden a couple of days ago where a guy drove a car through a crowd of folks and killed one and injured 7 or 8 other people. One of the most violent assaults that I ever witnessed in my law enforcement career occurred with a clothes iron. So I think a gun is just a tool, and that if somebody is intent on committing violence, against someone else or against themselves, they're going to find a way to do that. So I think that we need to look at the broader picture, which is how can we reduce violence in our communities? And also, how can we get, as some of the other folks have said, how can we get some mental health resources to these folks before we get to that crisis point where they are looking to use a gun, a knife, a car, a clothes iron to commit their act of violence. And so another thing that we learned in law enforcement was when someone is in crisis, that's the worst possible time to force a confrontation with them. Law enforcement has evolved over the years to recognize that, hey, when somebody is in crisis, we don't want to close the distance with them. We don't want to drive this confrontation. And unfortunately, a lot of times that's what these red flag bills can do, is force somebody, force law enforcement to have to confront somebody in their own home to try to take their firearms away. Doesn't actually solve the problem because there's a lot of other tools out there that they can use, but it drives that confrontation. Here in Colorado, they're one-sided. You don't have a chance to defend yourself, and that can be detrimental to victims of, say, domestic violence. If as a domestic partner I make an allegation against my victim that I've been abusing because I want to deprive them of their ability to defend themselves, there's not really a way to screen that out since you don't get both sides of the equation. So for all of these and a lot of other reasons, I don't really like Colorado.
Great. Thank you so much for your answer. And next, if we could hear from Spring Erickson on the same question.
I'm with Representative Amabile. I think they do help save lives. I've seen it firsthand as a Methodist minister. We had several people who, were talking suicide in a lot of the different churches that I've worked in, and I'd wished for 2 of them that we would have had a red flag law, because that was the most violent ending I can ever think of for someone. And now the family has to live with the fact that they couldn't stop their loved one. And I think that the red flag law has saved lives, and we need to continue to find ways to save lives. Yes, there are flaws to the red flag law, and I would agree with that, but those can be overcome through compromise with our partners in the legislature, and we can find ways to build a stronger law that both law enforcement feels they can work with, and yet we can save lives with it. And that's really all I want to say.
Great. Thank you so much. And look, we're making it right within our time frame. Thank you so much for being such cooperative respondents to some of the hardest questions. These are the hardest questions, it seems to me, and maybe not just because this is where I'm spending most of my time, but it seems to me these are the hardest questions that we face as a community. And what heartens me from a conversation like this is that there's some lack of complete accord and certainty with regard to the right next move to make on some tough things, but we're pretty much in agreement about where we'd like to be in terms of vastly enhanced health and safety for Coloradans. And the only way we're going to get to that better place is by having exchanges like this one, where we can tackle some of the hardest questions collectively. And just wanted to say how much I appreciate all of you for engaging in this and for taking these questions seriously, for the communities you serve most closely and for the state as a whole. We advocates for mental health very much appreciate our partnerships with elected officials and being able to engage all of you in conversation. We obviously have all kinds of thoughts and questions about all of these questions ourselves, and look forward to engaging you separately over the course of months to come on each of these. So again, with much appreciation and much respect for your service and desire to serve the people of Colorado and uphold the health and safety and well-being of communities all over the state. Thanks so much for joining us this evening.